Hello and Assalamu alaikum guys. My name is Fatma Samin, and today we are going to discuss the bony landmarks and site determination of femur bone. So femur is the longest and strongest bone in our body. It is a bone of thigh and it is considered as the long bone in our body. So as like all long bones, it has two ends, upper end and lower end, and a shaft. So firstly we are going to discuss the upper end of a femur. So at its upper end there is a globular head is present, and in between this head there is a small depression which is known as fovea capitis is present. It attaches the ligaments of the head of femur. After this head, neck of femur, there is a neck present which connects or provides a junction between the head and the shaft of the femur. The two trochanters, the above one is known as greater trochanter and this one is lesser trochanters. There is a line connecting these two trochanters is known as intertrochanteric line. This line connects the neck of femur with the shaft of femur. So this is the shaft of femur anteriorly. Anteriorly it is smooth and convex. As we say about the posterior side, the neck of femur is smooth and convex posteriorly, whereas it is somehow roughened anteriorly. So this is the lesser trochanter and this is the greater trochanter. The two trochanters are connected by the intertrochanteric crest posteriorly, and the crest is connected this crest connected the neck of femur with the shaft of femur. There is a tubercle present which is known as quadrate tubercle, which gives attachment to the quadrate femoris muscle. As we say about the posterior surface of shaft of femur, there is a line present at the posterior surface which is known as the linea aspera. It has three lips. This is the intermediate lip, and this is medial lip of linea aspera, and this is the lateral lip of linea aspera. Medial lip forms the pectineal line is known as pectineal line, and this is known as the gluteus tuberosity, which gives attachment to the gluteus maximus muscle. So the linea aspera is expanded at its lower end and forms a triangular shaped depression which is known as the popliteal surface and forms the popliteal fossa, floor of popliteal fossa. And at its end, at the end of this triangular surface, there are two ridges present. This is the medial supracondylar ridge, because it is at superior side of the condyle and at its medial side. So this is known as the supracondylar ridge, and this is the medial supracondylar ridge, and this is the lateral supracondylar ridge. After this, there are two there are epicondyle. This is the medial epicondyle and this is the lateral epicondyle. Why we call this medial epicondyle? Because it is the side of the head of femur, and remember that thing, head of femur is always at its medial side. We'll discuss it in side determination of femur. So this is the medial epicondyle and this is lateral epicondyle. There is a small tubercle present at its medial side. This is known as the adductor tubercle. After that, these two condyles are present. This is the medial condyle, this is the lateral condyle, and these two condyles are separated by a notch which is known as intercondylar notch. In this, there is a point to be noted that at its posterior side of femur there is a notch present which separates these two condyles, but at its anterior side there is no notch present. These two condyles are connected very smoothly at its anterior side. Okay, and this is the patella bone, which helps in the protection of knee joint. These two condyles forms the knee joint. knee joint, and the head of the femur articulates with the acetabulum cavity of the hip and forms the hip joint. So the femur has three border and three surfaces. This is the anterior surface, this is the lateral surface, and this is the medial surface. This is the posterior border, this is medial border, and this is the lateral border of the shaft of femur. And now we are going to discuss about the side determination of femur. For the side determination, the head of the femur, the side of the head of femur, and these two condyles are very important. Remember that thing, that always the head is present at its medial side, and these two condyles are present posteriorly. So in this way you can judge whether it is a left femur or it is right femur. And we can place a femur in front of invigilator or examiner. Like if you have a table in front of you, then place a femur in it. Always remember that these two condyles are facing posteriorly and head is facing medially. Simple. If you just focus on these two condyles, that the face of these two condyles are facing posteriorly, then the head is automatically of medial side. Okay. And remember that the femur is an oblique bone, it is not placed in a straight manner, so the head is facing upward and forward. So this is the position of the femur. So in this position what we have judged that it is a left femur. Okay. And if you don't have a table in front of you, so there is another way to hold femur in a correct manner. Place your thumb in the neck of femur and hold it like this. Okay. So this is also a correct way to hold a femur. So this is all about femur bone. Thank you so much.